Hello everyone. As our last class continuation, today we are going to see about the virulence factors and pathogenicity of corynebacterium diptheriae. Corynebacterium diptheriae is again classified into several serotypes based on its antigens. So the first thing, the corynebacterium diptheriae gravis is further subdivided into 13 serotypes, whereas the corynebacterium diptheriae intermediates into 4 types, and corynebacterium diptheriae is classified again into 40 types, and based on bacteriophage typing it is again classified into 15 types, whereas based on bacteriocin typing it is classified into one, that is the dipteriocin typing. The next thing is the virulence factors of corynebacterium diptheriae. The virulence factor of any organism determines its degree of pathogenicity. Here in this diphtheria bacilli, the virulent strains of the diphtheria bacilli produce a very powerful exotoxin. The virulence of diphtheria bacilli is mainly due to their capacity to first establish its infection in a host organism and its rapid growth rate. And after that, it quickly elaborates an exotoxin. Some avirulent strains are common among convalescent people and persons who are in contact with infected people and carriers, particularly the persons with extrafacial infection, that is, the persons who are having only facial diphtheria, that is, they affect only their tonsils. The most important virulence factor of corynebacterium diphtheria is an exotoxin, that is the diphtheria toxin. The signs and symptoms of the diphtheria is mainly due to this toxin. Almost all the serotypes like gravis and intermediate strains and other 80 to 85% of metis strains are toxigenic. That is, they can able to produce this diphtheria toxin. This diphtheria toxin is a protein and its molecular weight is about 62,000 Dalton. It consists of two fragments, A and B. It is a very potent toxin. About zero point 0.1 microgram is lethal to guinea pig. The exotoxin consists of two fragments, that is the fragment A and fragment B. Here the fragment B binds to a cell surface receptor and it helps in transport of the toxin into the host cell. So once after entering into the cell, the A subunit is released and that A subunit catalyzes the transfer of adenosine diphosphate ribose from NAD plus, and then the ADPR, that is binds to the elongation factor EF2. So the ADPR EF2 complex is inactive and it stops the protein synthesis abruptly, and then it leads to the necrotizing and neurotoxic effects of the diphtheria toxin. This image shows the mechanism of action of the diphtheria toxin in the host. The next one is the pathogenicity of corynebacterium diptheriae. The most common site of infection is the upper respiratory tract, like fauces, larynx, and nose. Occasionally, other cutaneous or mucocutaneous areas can be affected, like ears, eyes, genitovulval, or vaginal, or sometimes preputial or skin can also be affected. The most common symptom is the sore throat. Once after the infection, the bacilli multiply on the mucous membrane or skin abrasion. If it is a toxigenic strain, the bacteria produces a toxin, and the toxin, that is the diphtheria toxin, which evades the blood, is known as toxemia. Once the bacteria starts to produce toxin, the exotoxin is absorbed into the mucous membrane and causes a destruction of the epithelium as a superficial inflammatory response. And then the toxin causes local necrotic changes. So it leads to fibrinous exudate together with the epithelial cells, leukocytes, erythrocytes, and bacteria. So all these things together form pseudomembrane. So any effort to remove this pseudomembrane will tear off the capillaries beneath it and it leads to bleeding. So the mechanical complications are due to the pseudomembrane and the systemic effects are mainly due to the toxin. Once the bacteria start to produce toxin, the toxin is absorbed systemically and it damages the heart muscle, liver, and kidneys. This toxin can also cause nerve damage. The toxin absorption is negligible in case of skin infection with the toxigenic strains. If the infection is caused by the non-toxigenic strains, it can produce a local disease, but the systemic effects are absent in that case. The incubation period of this corynebacterium diptheriae in a human is usually 3 to 4 days. Mostly form acute infection in the form of membranous tonsillitis, nasal infection, and laryngeal infection, and the skin infection is uncommon. The characteristic feature is a wash leather elevated grayish green membrane in the tonsils with a well-defined edge surrounded by a zone of inflammation. So it mainly affects the tonsil area with a pseudomembrane. The infection of corynebacterium diptheriae can be classified into three based on its clinical severity. The first thing is malignant or hypertoxic, and the second one is septic, and the third one is hemorrhagic. The first thing, the malignant or hypertoxic, has the following symptoms like the bulging of the neck. So that is termed as bull neck due to the marked adenitis in their neck, and then leads to severe toxemia. Once the toxin is circulated in the blood, it finally leads to circulatory failure, and then it leads to the death of the person. If the person escapes from death, they may be affected by paralysis. And the next important thing is the septic one. And in this septic type of infection, ulceration, cellulitis, and the gangrene around the pseudomembrane will be there. And in case of hemorrhagic infection, the bleeding will be there from the edge of the pseudomembrane, epistaxis, and purpura. This image shows an infected person with corynebacterium diptheriae. Here you can see the bulging of the neck, that is bull neck, due to the cervical adenitis and edema of neck. The complications of diphtheриal infection are asphyxia, that is a poor supply of oxygen to the lungs, that is due to the mechanical obstruction. If the person is affected by asphyxia, emergency tracheostomy may be necessary. It is a medical procedure that may be temporary or permanent thing, and then it may also lead to acute circulatory failure, myocarditis, and the infection of diphtheria toxin can also lead to post-diphtheritic paralysis. So it may affect their palatine and ciliary nerves. Their recovery may also be there, either it may be spontaneous or complete. And in case of septic, the pneumonia and otitis media will be there. And at very rare cases, the relapse will be there. It is about 1% of the case. That is, after recovery, the condition will again become worse. It is very rare. So these are all some of the virulence factors and pathogenicity and complications of corynebacterium diphtheria infection. And I can see you in the next video with the laboratory diagnosis of corynebacterium diphtheria, which is much important in this diagnosis. Thank you.